Alright, so focusing on vaping cessation. I decided to go with vaping just because we don't see cigarettes as much in kids, at least from the statistics, so I feel like vaping's the big issue here. So this is our population of Routt County, and then 21% in 2020 was under 18. So that's the population I'm focusing on. Okay. Are the kiddos. So after talking to the nurses, we realized that vaping's a huge issue. These are the statistics that I found on the Health Partnership results appendix. So 47.6% use or have used e-cigarettes, which is pretty high. And then after talking to some of the the school nurses, they said about like 1 in 5 they think are smoking.
Wow.
From like 12 to 18. So it's definitely an issue. And then walking through town doing the windshield survey, I see kids vaping everywhere, even at work. The 16-year-old just vaping in the back. So it is a very common thing in that age group.
Yeah.
This is,
sorry.
Oh, no, you're fine. That's my SMART goal.
Okay.
So incorporate educational programs focusing on the effects of vaping and smoking in schools by 2024 to empower youth to stop vaping, resulting in a 10% decrease in the statistics of students who have ever used e-vapor products by 2026. So I figure give it like 2 years to hopefully work. Some of the harmful side effects, popcorn lung. They have seen like spontaneous pneumothoraxes in adolescents from using vape products. Some of the nicotine side effects are like increased heart rate, contractility, so a lot of heart issues relating to nicotine. It also affects their brain, so their learning attention span, which is always, I feel like, a challenge with kids. And then the flavorings and the things in the actual e-cigarettes are pretty harmful. And I didn't realize this, but they have not been regarded safe by the FDA, which is obvious now that I've learned that, but.
Do you think the FDA would deem anything about vaping safe?
I don't think so, but
yeah.
And I mean, I don't think any of the products are gonna be regarded safe, but yeah. Even the non-nicotine ones are just, these are kind of my interventions. I decided to focus on 3. So get cessation programs in schools. Also, a lot of people do smoke because that's how they deal with their stress. So also focus on stress relieving programs, like better outlets to deal with their stress, and then a mentor program for kids who do want to quit, who do have an addiction. So these are some of the models that I found, and I can go through those real quick. I found this on a study that kind of looked at, in 2020, they looked at a bunch of different cessation programs, and they used Google, just kind of reviewing them, and found these are like the common trends that you need to have a successful program. So the theory of planned behavior, I have some notes here, is to predict an individual's intention to engage in a behavior at specific time and place. The social cognitive theory is the influence of individual experiences, the actions of others, and the environmental factors of the individual. Trans-theoretical model explains the individual's readiness to change their behavior. Positive youth development is to provide youth with networks of supported adults. And then the optimal health framework is adaptable to range of risk behaviors and diseases. So kind of utilizing all of those models in mostly the cessation program and the mentor program for kids to quit. So yeah.
Do you think they would be, like, if they knew that those products, like the flavorings, were harmful, do you think that would change kids' minds at all?
I think it would change some minds. I feel like kids know like smoking is bad and like probably like I'm sure they're aware, like there was that statistic like 76% of them knows it's harmful.
Right.
So there is that awareness, but I think a lot of it is just kind of they hear about it but they're not like fully immersed in like how harmful it actually is. So I feel if you just kind of had like little seminars like once a year, once every like the spring and the fall, where you just kind of keep reviewing that information. It might reach a few kids, just kind of the harmful effects.
Do we bring the black lung?
I know. I thought about that, like bringing the, yeah.
Like
and I was thinking like, even if you brought like a COPD patient or someone who does suffer from popcorn lung, like if you could find someone in the community and like show them, because I don't know who it was it you maybe? A kid was doing the mentor program for the, what do they call it? It's the program where they're interested in healthcare, the high school, and they do all their clinicals in the hospital, and there was one girl who saw an alcoholic and it just like completely freaked her out and like definitely changed her mindset. So I feel like maybe the scare tactic could work in that.
Yeah.
And even like the black lung, but like showing what a popcorn lung looks like, because that creates permanent damage.
Yeah.
And it creates so many issues down the line. And I feel like you hear about it, but I just feel like if it was constantly like ingrained in their mind, it would reach a few people, I'm sure.
Yeah.
I know it's hard.
Shock and
awe. So this was kind of a way I thought we could do the program, is like maybe just like implement them as part of their school, like in their health and science classes, even have seminars for teachers, or you can have a guest speaker. Further on, I'll explain the like mentor program, but like even if you just had a part-time person at public health who would go into the schools and just do a class, and maybe all of their science class or their health class. And then I think it should just be like every year, just so it's like constantly in their head. Because I feel like you can learn something and then you'll change your ways for a bit, and then if you don't hear about it for a while, then you can kind of just fall back into it. So yeah, that's kind of a yearly exposure. And then stress relief strategies. So a lot of people use nicotine because they're stressed, and I mean, I've seen that a lot with people, just they have a stressful moment, they step outside for a cigarette. So just implementing a lot of the stress relief strategies in schools, and I'm sure there are a few teachers doing this, but kind of make it mandatory and have seminars for them to teach children these strategies, just like better outlets. And then
next slide.
Yeah. Okay. And then for quitting, I think it would be cool to have like maybe that person who works for public health, just like a text line, since kids love texting, where if they are like feeling under pressure, or they are like kids who really want to quit, like kind of a mentor, like what you would have in other like AA or something, but that they can just reach out and just be like, hey, I'm having this feeling of like wanting to, I don't want to smoke again or something. They could just give them a little bit of advice or something. I thought that would be cool. And this was a study I found by the Minnesota Adolescent Community Cohort, some of the barriers. I think a lot of the ones that would affect the kids here are definitely like the friend smoking, obviously the cravings, and then just, I feel like a lot of the quit aids probably aren't appropriate for kids because they are like nicotine patches, so I'm not sure how.
Yeah, what are the age limits on those?
I feel like it's 18.
Is it 18?
I could be wrong though, but these were just some of the, like a loss of a way to handle stress, where I feel like that stress relief program could help.
Well, and that's from 2017. I wonder how that has changed.
I know.
In these stressful times.
Yeah.
So the
Yeah,
cost
especially
of
with the-
quit aid seems, to be a lower barrier, but so some counties, states have put taxes on vaping
Mm-hmm.
to increase that cost. Do you think that would be, do you think cost of vaping products is a barrier to our youth here in Routt County?
Like obtaining
Like
them?
if the cost increased, like if we put an additional county tax,
Yeah.
let's say on vaping products, and it became kind of not very affordable, do you think that the kids would still find a way to get it, or do you think
I'm sure they
increasing
would.
the cost would cut down?
I mean, I know like when I lived in Australia, a pack of cigarettes was $60, and that caused a lot of people to quit. I mean, that's a
Yeah.
ridiculously high jump compared to what vape pens are now, or what cigarettes are now here. So yeah, I think increasing the cost drastically would probably cause a lot of the kids, like even just the cartridges.
Right.
And I know in like Aspen they banned a lot of the cartridges, and that like created a lot of reduction in kids. So yeah, and I didn't fully focus on that because I was kind of focusing more on like the cause rather than like the prevention, but that would be, I think taxing it would be great, and if we put just a ridiculous tax on it. I'm just afraid of like the adults who probably can't afford like cigarettes already or vape products already might suffer financially even more. But yeah.
And then the money could go to public health.
Yes, to these programs.
Public health tax.
Right.
Yes. Yeah, there we go. I feel like every little vice should be taxed heavily. And
They call
gone
it
back.
the sin tax.
Yeah.
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 Sin taxes.
So the way that I figured you'd evaluate this is the surveys that they give to the kids. Just try and do them like every 2 years, but do one right before we start the programs, and then do another one in 2026. Yeah, so that you can compare every other year. So yeah.
When do they do the Healthy Kids survey? That's every 2 years? That'd be a
I
great
think
time to
so.
start a program right
Yeah.
after they do that survey.
Yeah, because they're looking at getting buy-in for that this winter, so like in December, January, because the lady who runs that program, Fritha, connected us
Okay.
to try to maybe have a discussion with South Routt and Hayden to kind of open up their thought process in making that survey more widely available.
Yeah. Didn't they just do it this last spring?